We believe that we will have our first set of vaccines pretty close to after the FDA gives emergency authorization. We believe that we could be vaccinating people here in Kentucky as early as December 15th, just right around the corner. And remember, our first shipments, which are about 38,000, about two-thirds of those are going to go to long-term care. CVS and Walgreens is going to do that program. Here is the other third. Today, we're announcing that the other third of vaccinations, which are intended for our frontline healthcare workers, those dealing or exposed to COVID the most, think those working in the emergency room or on COVID wings. We have our first allocation that's getting out there to help vaccinate them once we get authorization. Now, it is a fairly small amount as compared to healthcare workers across Kentucky. So these are just the first 11 sites that are going to receive them. We hope that Moderna has their 70-odd thousand doses, which is at least twice as much as the one we're looking at here coming out 2 weeks later. Not everybody could be in this very first grouping. So the initial allocation sites were chosen because they were large enough to handle the minimum pallet or size of the Pfizer vaccine that shipped, and that is 975. You can't get a shipment that's less than that. They were selected because the CDC required that they had to have ultra-low cold storage. They were selected because they had completely enrolled as a COVID provider, and not everybody is completely enrolled yet. We wanted good coverage area in Kentucky. So you see we have sites in western, eastern, south central Kentucky, as well as some of our most populated areas. And we also looked at high incident rate sites. So here is the list. It's Lourdes Hospital will receive 975, Pikeville Medical Center, 975, University of Kentucky Hospital is getting two of the pallets, 1,950. That's two of the groups of 975. Baptist Health Madisonville, 975. Baptist Health Louisville, 975. St. Elizabeth Healthcare Edgewood, 975. Baptist Health Corbin, 975. Baptist Health Lexington, 975. Norton Hospital getting two pallets, 1,950 doses. Medical Center at Bowling Green, 975. University of Louisville Hospital, 975. So that will be 12,675 frontline healthcare workers that we hope as soon as December 15th can get these first series of vaccinations. And we're allowing each of these facilities to make their own allocations based on tiering that they have done with their staff. They know who is most at risk and have done that analysis. Those still needing to enroll as a provider can do so by our website, kycovid19.ky.gov. It also includes healthcare provider guidance, the Draft Kentucky Vaccination Plan, which has our planning phases in it, critical populations, and vaccine provider enrollment and administration. So there are a limited number that we could include in this very first shipment. We did our best. Those that are not receiving it, I know very much want it to protect their individuals. We are going to be further spreading this out in future allocations. This is in many ways our test run, the very first time. So our plan is to get these 11 providers on the phone with everybody else that's looking to be a provider so that we can learn from their experience in this first time. So that 2 weeks later, when additional facilities get the first shipment of Moderna, we hope, that's a projected timeline, that we can do even better than this first rollout. But remember, even if you're not a part of this very first shipment, it's exciting that there is a shipment of a vaccine that looks to be about 94% effective. The hard thing is that's so exciting, it's going to be very difficult to be patient. But we need to be patient. And that includes both other healthcare providers, different parts of our population that sure are at risk. We have a very limited quantity right now. We're going to make sure that those most vulnerable in long-term care that make up about 66% of all of our deaths, have first priority along with our healthcare workers that are in there caring for COVID patients right now.